Order. Question number 11. Order. Kevin Hague.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks, how many New Zealanders are expected to have diabetes in 2021, and what is the expected cost of providing health services for them?
Honourable Tony Ryall.
Mr. Speaker, a number of studies have attempted to estimate the number of people who may have diabetes in the future. It's a very complex issue to calculate. I'm advised there's not yet an agreed methodology amongst the experts. I'm advised by officials that a report produced by PricewaterhouseCoopers in 2008 has put the cost of diabetes rising from approximately $600 million in 2008 to $1.5 billion in 2022. A New Zealand study by Joe Tobias and Ye predicts a 20% increase in the prevalence of diabetes from 2012 to 2021, which would mean 271,000 New Zealanders. And I'm aware of further advice from the head of the Diabetes Advisory Committee that the number could be 386,000 if there's no change in practice or management. The government's committed to improving health services for diabetes and heart disease with a strong focus on prevention. And in Budget 2013, we announced a boost of new funding for New Zealanders with or at risk of developing diabetes and heart disease.
Supplementary.
Supplementary question, Kevin Hague.
Does the Minister dispute the PricewaterhouseCoopers estimate of $1.78 billion expenditure in 2021? And does he accept the findings of the University of Otago research recently published showing that a much higher prevalence of diabetes and pre-diabetes in the New Zealand population, currently 1 in 4 adult New Zealanders, and higher prevalence in other population groups, mean that that's likely to be a significant underestimate?
Honourable Tony Ryall.
I think the answer that I gave to the member indicates that depending on the assumptions that you use and the various numbers that you put in, you can get a range of results. What I do think the member has touched on quite rightly, though, is the importance of investing in prevention, but particularly in the identification of pre-diabetes. This is the biggest increasing pressure in much of this space, is pre-diabetes, and that's the reason why achieving 90% of New Zealanders getting a heart and diabetes check means that we can actually identify those at risk of pre-diabetes and enable them to make the vital lifestyle changes needed in order to prevent themselves from getting that disease.
Supplementary question, Kevin Hague.
What is the likely availability of funds to meet the costs of diabetes treatment services that should be anticipated in 2021, likely to more than treble over that 8-year period, and exceed $1.78 billion in 2021 alone?
Honourable Tony Ryall.
Mr. Speaker, the advice that I have is that those numbers are premised on no change in the way that we manage diabetes or the activities we have in order to prevent diabetes, or more importantly in many ways, the development of pre-diabetes amongst individuals. That is why the government is focused very much on increasing the number of heart and diabetes check in order for those people at risk to have that identified by their GP and be able to get the lifestyle changes that they needed. Also in this year's budget, the government has invested significant new money in expanding local diabetes care improvement programs. We've provided additional money for encouraging more checks, and also a very significant investment in doubling the number of green prescriptions that GPs can refer patients to.
Point of order, Mr. Speaker.
Point of order, Kevin Hague.
My question related to the availability of funds to meet the sum that PricewaterhouseCoopers anticipated would be required, and I think most would accept is going to be more than that $1.78 billion in 2021. The Minister in his earlier answer indicated that there was some dispute about what the number was, but that didn't prevent him, in fact, from responding about what the likely availability would be. I mean, say in a range of $1.5 to $2.5 billion.
I accept the point of order the member's making. I think To be fair to the member, he tried to the Minister, he tried to very adequately address the question, but if the Minister wants to address just the part about the availability of additional funding, that would be
what will be important for the availability of funds for affording the demands of diabetes and any other health disease is that New Zealand has a strong, growing economy. Economy where taxes are low, where regulations are under control, where government spending is well spent. I do not think we'll meet those costs by printing the money in 2021.
Supplementary, Mr. Speaker.
Supplementary question, Kevin Hague.
In the light of the Minister's apparent confidence that there will be available funds to meet a $1.78 billion health services bill for diabetes alone in 2021 alone, could I ask the Minister, how much money would it have been rational to invest in obesity prevention in this year's budget? And how much would it have cost to reinstate the healthy food requirements in schools?
Mr. Speaker,
Tony Ryall.
look, I think it would have been rational to have the investment that this government is making in the area of diabetes and helping people manage their weight. The government's spending $60 million a year on prevention initiatives, which include fruit in schools, which is funding was going to be stopped under Labor, a range of nutrition and breastfeeding programs, and a very significant investment in Kiwi sport. So across the range and across the life course.
Point of order, Mr. Speaker.
Point of order. Kevin Hague.
Mr. Speaker, can I clarify whether the Minister's answer is that the government invested the perfect rational amount in obesity prevention?
That's how I took the answer effectively, yes.
Point of order, Mr. Speaker. I seek leave to table two documents. The first is the PricewaterhouseCoopers report for Diabetes New Zealand entitled
Can I just clarify how available that is for members?
It's not readily available.
Okay, I'll take the member's word for it.
From September 2008. And the second, sir, is the report of the research by Koppel and Mann and others entitled Prevalence of Diagnosed and Undiagnosed Diabetes and Pre-Diabetes in New Zealand, Findings from the 2008-9
Leavers sought to
Adult
table
Nutrition Survey.
those two documents. Is there any objection? There appears to be none. They can be tabled. Question number 12. A point of order, Honourable Annette King.
Table report from Stuff where the Minister of
Stuff
where the Minister of Health said he wouldn't help families get thin.
Stuff is freely available. Question number.
Mr. Speaker.
Supplementary question, Brendan Horan.
Does the Minister expect that the hundreds of thousands of New Zealanders forecast to have diabetes by 2021 should have access to accurate and reliable blood sugar kits? And is he aware of the many expressions of concern from both health professionals and diabetics around the new sole supply CareSense kits with life-threatening reports of inaccurate meter readings and faulty test strips?
Honourable Tony Ryall.
Mr. Speaker, the Pharmac has moved to sole supply arrangement for most people for their blood glucose and testing kits. I have to say that as I've been travelling around the country, I think the transition has gone remarkably well, actually. We now have about 90% of those people on the previous meters have transitioned, and I think that most people are finding the service up to what they might have expected, and we've had very, very little feedback counter to that in the last few months.
Question number 12, Honourable Phil Heatley.
Mr. Speaker, and my question is